Morning students, today we will be discussing the new topic of hemorrhagic disease of newborn, also known as HDN, vitamin K dependent. This is vitamin K dependent. Just try to understand, let us say in the body you get a cut anywhere, immediately the bleeding stops because clotting factors start playing it their part. And the clotting factors, as you know, they are 1 to 13. In the newborn, what happens that the vitamin K is deficit. Why? Because transplacental passage of vitamin K is very less. The liver stores of vitamin K, they are also very less. There is minimal transfer of vitamin K through the breast milk, and the intestinal flora, they have yet not developed in the newborn, because intestinal flora, they are responsible for producing the vitamin K. So what will happen once the vitamin K is deficit in the body? The clotting factors which need vitamin K for their proper functioning, the functioning of those clotting factors will not be optimal. Is it clear? So what are those factors? These are factor 2, factor 7, 9 and 10. In the normal person, these vitamin K is available from the food and the dietary supplements, right? And the bacteria in the intestinal gut, they produce vitamin K, and vitamin K leads to the optimum functioning of these factors. What happens in the newborn? Newborn doesn't have vitamin K, neither from the mother, nor through the breast milk, nor through, he has got liver stores, and in the gut, as the child is taking only breast milk, so he doesn't have the intestinal flora to produce the vitamin K. So once this situation arises, then what will happen? There will be deficiency of these factors. So, and the maternal factors, they also come into play. If the mother is on drugs like phenytoin, you know when it is used to control convulsions, or warfarin. These two drugs or similar drugs, they also hamper in the clotting mechanism. So this hemorrhagic disease in the newborn starts due to these reasons, this pathophysiology. It can manifest within 24 hours, that we call early. It can manifest a bit later, 2 to 7 days, classical, or in 1 to 6 months also, that we call late onset. This is early HDN, this is classical HDN, and this is late onset HDN. Let us say a newborn child which you have discharged one day after, and the next day the mother comes कि जी इसके जो अम्बलाइकल कॉर्ड है उसमें से ब्लीडिंग हो रही है. ब्लीडिंग इज सच ए थिंग जिसके बारे में पेरेंट्स, दे आर ऑलवेज सो वरीड एंड पैनिकी आल्सो. सो और जैसे 2 to 7 डेज है वहाँ का GIT OT की, उसमें ब्लड आ रहा है बच्चे के. जब बच्चे ने कोई वॉमिटिंग कर दी उसमें ब्लड आ रहा है. इन सम ऑफ द कल्चर्स early circumcision is done in the male children. So circumcision किया तो ब्लीडिंग स्टॉप हो जानी चाहिए आफ्टर द सर्जरी. लेकिन उसमें प्रॉब्लम क्या है कि ब्लीडिंग ही नहीं बंद हो रही, राइट। तो लेट ऑनसेट में कहाँ हो सकता है, यदि थोड़ा सा नाक से खून आया तो उसके बाद रुकने का नाम ही नहीं ले रहा, एपिस्टैक्सिस शुरू हो गया। और जैसे इंजेक्शन लगता है बच्चों को, इंजेक्शन लगाया एएनएम ने, लेकिन उससे ब्लीडिंग नहीं बंद हो रही इंजेक्शन साइड, और ए वेरी सीरियस कंडीशन के इंट्राक्रेनियल ब्लीड भी हो सकती है। सो ऐसे केसेस में क्या है कि प्रिवेंशन, दिस इज द बेस्ट मेथड। क्या प्रिवेंशन में क्या करते हैं, हमने न्यू बॉर्न केयर देखा था। एट बर्थ व्हाट इज गिवन, विटामिन के इज गिवन 1 मिलीग्राम इंट्रामस्कुलर। जो बच्चे प्री टर्म होते हैं लो बर्थ वेट, उसमें 0.5 मिलीग्राम इज गिवन routinely to all newborn. This is a neonatal practice. And if diagnosis is needed, then you will need to do these investigations: prothrombin time, activated PTT, platelet count, and clotting factor assay. These may be needed, but sometimes usually the clinical diagnosis is clear from the clinical finding. The child is active, playful, but bleeding is there. This has to be differentiated from DIC, disseminated intravascular clotting, in which the child is very sick. Bleeding भी हो रही है, बच्चा बहुत बीमार है, सिक है, दूध नहीं पी रहा, लेकिन इसमें क्या होगा कि बच्चा एक्टिव है, दूध भी पी रहा है, खेल भी रहा है, लेकिन ब्लीडिंग नहीं बंद। दिस मीन्स कि ये विटामिन के डिपेंडेंट ब्लीडिंग होगी, राइट। प्रिवेंशन हो गया। ट्रीटमेंट, यदि इफ देयर इज ए सीवियर ब्लीडिंग देन व्हाट विल यू गिव, तो फिर 1 मिलीग्राम विटामिन के काम नहीं करता, यू विल नीड टू गिव 1 to 5 मिलीग्राम। वो फिर आईवी भी देना पड़ सकता है आपको, रूटीनली भी गिव इंट्रामस्कुलरली। देन in conditions where intracranial bleed is there, you may need fresh frozen plasma also, or blood transfusion, right? So this is factor of HDN you should be aware as you will be going into the field and attending to the deliveries. If you want to ask, you can ask. Okay, thank you.